Good afternoon. Welcome to the show. It's Saturday, June 5th, 2010. My name is Michael Weiss. I'm the host of Healthcare Reality, sometimes called A Crohn's Disease Life. But the bottom line is, I'm somewhat of a professional patient, and if you haven't watched before, I give my opinions and some helpful thoughts about healthcare. I'll get into why I'm a professional patient later. But the topic of today's show is that nurses are the key to the healthcare system. That's the title, and it manifests itself in many, many ways. And that's why when I think there's any type of healthcare overhaul, they really need to figure in nurses first. What do I mean by that? Well, as a patient, when you're in the hospital, you see that doctors give orders. They write them down, they're great, but then nurses have to execute them. So nurses have to listen both to the patient and to the doctor, and then they have to administer what he or she, the doctor, recommends. Vitally important. The other thing about nurses is that a lot of patients can't explain themselves to doctors. Sometimes they're not in a position to, sometimes they're intimidated, sometimes they forget. You're sort of very vulnerable in a hospital when you wake up in the morning for rounds at 7 a.m., you slept 3 hours, and then there's 9 doctors surrounding your bed. What's up? How'd yesterday go? It's just too much. So if you communicate well with nurses, they will communicate with your doctor and tell your doctor what's wrong with you, what's working, what's not working, what you might need help with. It's very, very important. And keep in mind that, nurses see people, myself included, at our worst. When we're in pain, when we're not feeling well and we're pissed, we have to be hospitalized or in the ER and we've been waiting for hours. We know how much it's going to cost. And yet, for the most part, in my experience, nurses have been excellent. They somehow are able to have thick skin and not take anything personal and understand that we all get sick and it's a very difficult thing to deal with. So I think it's very important as a patient that you understand the significance of nurses, and that therefore you treat them well. You should treat everyone nice, but you should especially treat nurses very nice. Look at it this way: a doctor is like a quarterback. They get the press, okay, they get the records, they can make the Hall of Fame, but they're going nowhere without a good offensive line, a left tackle, okay? Nurses are that offensive line. They protect the doctor, they protect the patient. They basically have to deal with both interests. Now, how do you deal with a nurse in the hospital? When I was young and I was diagnosed with Crohn's disease at about 21, 22, and I remember being in Mount Sinai Hospital in Manhattan, and every time I needed pain medication, I'm 47, so it was like in the 80s, I'd have to hit a button, and then I'd wait for the nurse to come. Well, I felt like I was in a hotel, and when I hit the button, my pain medication would magically appear. That's not how it works. And I think the nurses picked up on my attitude and became a problem. And I had to grow up and learn. The other thing that you need to learn is that sometimes patients have emergencies. And typically nurses are way overworked. Maybe there's one nurse to 4 or 5 or 6 patients, depending upon the hospital. And if a patient has an emergency, you're going to have to wait. And what I've learned over the years, and it's been pointed out to me, that, listen, chill out. Sometimes that emergency is going to be you. So have patience, have respect. And I've learned that. And try to get familiar with the nurse's schedule, because there are shift changes, and before every shift change, the nurse has to sit down and write a report up on each patient, what their progress is, what their status is, so that the new nurse can just, take over seamlessly. So whenever you need something, try to figure out when the shift changes so that you don't overly burden the nurse. Always say thank you, no matter what they do. Always say thank you. Whether it's just the simple giving you of a pill, and I could say from personal experience, I had spine fusion surgery in 1999 or 2000, and I needed to call the nurse every time I had to shimmy from one part of the bed to the other. I felt horrible having to keep calling this nurse if I got uncomfortable. I mean, they're called on to do that, obviously to do much more graphic things with many elderly patients, but I felt so bad that they had to help me move, and they just smile. So it's it's incredibly important that nurses are given their just due, not only by society, but by patients and by doctors, and by any kind of changes to the healthcare system. Now, a lot of people talk about private nursing and when do you hire them, how do you hire them, who do you call. My experience has been a physician will tell you whether you'll be in the hospital for a couple of days or a week. Now with health insurance and everything, it's usually a short period of time. But if you're going to be in there for a while, ask the doctor, do you think I will require additional care? And doctors, I don't think, are really in tune with both the realities that the nurses face, in that there are 4, 5, 6, 7, or 8 patients to a nurse, and they can't possibly deal with the responsibilities in as expeditious a manner as patients would prefer, or they downplay the seriousness of the symptoms. I mean, spine fusion surgery. When I had to call a nurse to help shimmy me with blankets with another nurse, or sheets, to go from one side of the bed to the other, that took her away from 4 or 5 other patients who may have needed a pill or whatever. I mean, the fact that the doctor didn't tell me in that case that, you should really think about getting a private nurse, you know what, I think maybe he should have thought about that. He was a great surgeon, by the way. I don't mean to single him out. But there's a lot to consider there. I think it's what is the procedure, how old is the patient, and I wouldn't have a private duty nurse for too long. Just have the private duty nurse for the 1, 2, or 3 days where you're really going to have to rely upon someone. So for me, when I've had resections in my intestine or spine fusion surgery, usually it's the first post-operative days that I would have someone there, because I felt too needy. I didn't want to bother a nurse, with having to help me, and it just gave me security also to know, psychological security, to know that someone was there. It could be costly, like $200 a day, $250 a day. Your insurance company may or may not pay, depending upon, again, the procedure, your age, your policy, etc. And it's things like that. And also keep in mind that there's politics and everything, and I think there's politics in nursing, and your private duty nurse has to fit in, and you just kind of nuance, just be nice, just nuance everything and be nice. All you have to do is be nice and acknowledge the fact that nurses are key. Other little tips before I go. Keep a notepad next to your bed so that you could write down questions, because the more you could take off the nurse's shoulders, the better. You don't want a nurse saying, oh, okay, thank you for mentioning that. I will make sure I ask the doctor that. They may forget, and because they're only human. So I would keep a notepad there. And also, when a doctor comes in to see me, when I'm in a hospital, and we go over medication changes or procedures or diagnostic tests, I will double check maybe like a half hour later with the nurse when he or she is available, and I'll say, did he or she, the doctor, change my orders? What are they? Because I want to make sure that there's communication, because I don't want to have to call the doctor at 3 o'clock in the morning because they changed my orders on a medication that I may need. So try to think ahead. Try to make a nurse's life as easy as possible, because she's the key. She's your left guard, okay? When you're fading back to pass and someone's looking to knock you out, she's going to block for you. He or she, sorry. So take that seriously. And who am I? So, like I said, I'm a professional hospital patient. I actually wrote a book about it called Confessions of a Professional Hospital Patient. As I said, I've had Crohn's disease. It's a chronic, incurable illness, primarily affecting the digestive tract. It's very, very painful, but I wrote a real account of what it was like, both in and out of the hospital, to deal with chronic illness, and like the importance of support with my friends, and some of these points, like what to do with nurses and whatnot, and how to handle them, and the hierarchy of importance of well, like I said, be nice to everybody, but nurses, the absolute key. You could purchase the book Confessions of a Professional Hospital Patient at Amazon.com or BarnesandNoble.com, or even on my site at HospitalPatient.com. And on my site there's a free chapter, a sample chapter called The Emergency Room, and there you can get a demonstrative chapter of how I write, sort of how I speak. If you dig it, you like the book. So anyways, if you have any ideas and you'd like me to chat about them or research them, just drop me a note at michaelweiss@hospitalpatient.com. or sign up for this YouTube video stream, and you'll get these videos automatically. Leave me a comment or hit me up on Twitter. My Twitter name is @hospitalpatient, and hospitalpatient.com. I told you about the website. I think you could send me an email there as well. So thank you very much. And again, nurses, 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 very, very important. And some of them are really pretty too. So you also have that. So that's a good thing. Okay, bye.